What can you do about it? So if you are a concussion patient, just consider that anxiety could be involved. If somebody suggests that anxiety could be involved, try not to get your back up about it, okay? I know that healthcare professionals are not very good at delivering that and providing the education around it. It is a difficult subject to broach, and so it does take a little bit of skill to be able to bring it up. But if you are a concussion patient and you're listening to this right now, or you're watching me on YouTube, or you're watching me live, just consider that maybe anxiety could be playing a role in my recovery, because it likely is to some degree. In most cases of PCS, post-concussion syndrome, mental health and anxiety play a role. And in some cases, it's the entire thing, right? By treating the anxiety, we can get rid of all symptoms and the person is back to 100%. In some cases, it will get rid of a portion of the symptoms, but there's still some remaining. So it just depends on to what degree it is involved. But if we consider that every concussion patient, and we just think this way, if every concussion patient has some degree of mental health or psychological overlay, whether it be anxiety, depression, post-traumatic stress disorder, catastrophization, pain sensitization, any of these things, we can think about things differently. We can provide education. We can provide encouragement. We can provide the reassurance that's necessary. We can introduce psychological interventions alongside our physical interventions, things like cognitive behavioral therapy, which can help disrupt negative thought patterns, can help us kind of develop tools and strategies to help us from going down this spiral when things happen. We can develop these things when we're not in a state of symptom provocation, so that when this happens, we have the tools to kind of get ourselves out of it and not spiral out of control. But this takes work, right? You have to build these skills. This isn't something that's just a quick fix thing, right? Medication might be necessary. So here we go. As a patient, number one, consider that it could be involved. Don't put your back up against it. Just embrace it, okay? There's likely some element of anxiety on my case. I know that, and that's how it is. Next, involve the help of a mental health care professional, particularly if you realize that you're getting involved in avoidant behavior. If you're avoiding any activity that may provoke your symptoms because you're worried about it provoking your symptoms, that's an avoidance thing, okay? So try to seek the help of a mental health professional. Things like cognitive behavioral therapy are very, very good at helping you develop the thought pattern of why you're going down this road, and then what can we do to counteract that? What are some ways that we can, develop tools and strategies to avoid going down this path, right? I see questions coming in, so don't worry, guys. I will get to it. So develop the tools even when you're feeling good, so that you have the strategy in place when things go bad. Number 3, work on yourself to heal from within. Right? A lot of my episode last week was talking about the sympathetic and parasympathetic nervous system and the imbalance that is created in the autonomic nervous system. A lot of this has to do with elevating parasympathetic, but it also has to do with general health. What you eat can influence this. It can influence your gut. It can influence your inflammation. Inflammation can influence your stress hormone response. It can influence your sleep. Sleep can also increase anxiety. If you're not sleeping well, your anxiety will go up. So you have to look at this from a holistic standpoint. You can't just go, well, I'm just going to go see a psychologist and that's going to be it. You also have to eat right. You have to exercise. You have to get your hormones kind of balanced. You have to work on things to increase your parasympathetic tone, right? That may be breathing exercises, that may be meditation, that may be singing, that may be hanging out with friends, laughter. All of these things help to stimulate the parasympathetic nervous system and reduce the sympathetic nervous system to get yourself into a bit more balance. So part of it is that. Part of it is also education. Learn everything there is to know about it, right? Know your enemy. If PCS is your enemy, right? Learn everything you can about it. Why does it happen? What systems does it affect? And why and how? And then what can we do about it to reverse those effects? And then every day, you're going to start reversing those effects, right? Once you know your enemy, you can conquer your enemy. If you don't know your enemy, it's scary. Everything is scary. And that provokes anxiety, right? Fear provokes anxiety. So knowledge is power, okay?